So the first patient with LAL-D that I met 10 years ago was a 6-week-old infant. He was born full term with a normal weight of 3.5 kilograms. However, soon after birth, he started vomiting, he started losing weight. He was not able to gain his birth weight, and eventually he had significant abdominal distension. He developed fevers, decreased activity, and presented to the hospital. At first it was assumed that he probably had sepsis. A full sepsis workup was done. A wide differential of diagnosis were considered. He did have hepatosplenomegaly, so enlargement of his liver and spleen. And then on x-rays it was noted that he had calcifications of his adrenal glands. So at that time, our suspicion for what we called this Wolman's disease back then was much higher. In fact, he did have an LAL-D testing, and the enzyme activity was not seen at all in his leukocytes. So he did not have any detectable enzyme. Over the next few weeks, he unfortunately progressed. He went into liver failure, multi-organ failure, and DIC. And the family had to make a very difficult decision. At that point, the only potential treatment to consider was a bone marrow transplant, and he was extremely sick. And the family was concerned that he would not withhold the treatment, and the choice was made to just seek palliative care for him. He passed away 10 weeks of age. So today, if an infant presented with a similar picture and we recognize this diagnosis the way we did back then, we would actually have enzyme replacement therapy available to treat this infant. This has been the only treatment that has been shown to have efficacy in infant presentation of LAL-D. 10 years ago, this was not an option.